Good morning. Joan and I are honored to be here today, besides this year's legendary heroes, and of course, our inspiring youth speakers. Wow, it's really such an amazing set of stories. Many of you know that 51 years ago, our mother, Dr. Joan Morgenthau, who is an attending pediatrician at Mount Sinai Hospital, founded the Mount Sinai Adolescent Health Center. She was a professor of clinical pediatrics and preventive medicine at the Mount Sinai School of Medicine, now the Icahn School of Medicine at Mount Sinai, and she became Dean for Student Affairs. Her vision, which the center still embodies today, was that young people deserve and should have access to comprehensive, free, and confidential health care, and she believed that young people need to be healthy to make it in the world. The annual Dr. Joan Morgenthau Lifetime Advocate for Youth Award was created to honor our mother and those who followed in her footsteps as leaders and whose efforts on behalf of young people have made a real and lasting difference. The 2019 recipient of the Dr. Joan Morgenthau Lifetime Advocate for Youth Award is most deserving. Please join me in honoring Raja Flores, MD. Dr. Flores is a world-renowned thoracic surgeon known for his technical skills and lifelong work on lung and esophageal cancer, mesothelioma, and asbestos-related diseases. His research has produced over 200 publications, and he's the principal investigator of a $4.8 million R01 grant to study the effect of asbestos contamination in the town of Libby, Montana. Educated at NYU, Einstein, Columbia, and Harvard, he's a professor and founding chairman of the Department of Thoracic Surgery at the Icahn School of Medicine at Mount Sinai. Dr. Flores has generously seen some of our adolescent patients who could benefit from his particular surgical skills. He has conducted surgery pro bono for young people who would have had difficulty in getting treatment for lack of insurance or monetary resources. He's always been so kind and gracious with our young people and their families, treating them with tremendous warmth, respect, and dignity, visiting them daily and ensuring that they get the best follow-up care. When young people are scared about the surgery they face, he's been tremendously skillful in communicating with them and reassuring them. More importantly, Dr. Flores has a lot in common with the kids we treat at the Mount Sinai Adolescent Health Center, as he grew up poor Latino with a single mother in New York City. We are proud to present him with the Dr. Joan Morgenthau Lifetime Advocate for Youth Award, and were she alive today, our mother would have been so proud to honor him too. Thank you. Dr. Flores.
Thank you. Out of curiosity, how many of you here have been to the Mount Sinai Adolescent Health Center? Boy, more than I expected. So I'd like to explain to you what I saw last time that I was at the Mount Sinai Adolescent Health Center. I was on the first floor. In a narrow hallway, there were a row of kids, about 10 of them, sitting on chairs. Just like what kids do, they're falling on top of each other, laughing, joking, sharing things on their cell phones with one another. There was a boy and a girl in a corner making out. That's what kids do. Why were those kids there? Did one of them have the flu? Maybe they were getting birth control? A cavity filled, eyeglasses. Maybe they were getting HIV medication, insulin for their diabetes. I also saw offices for social workers and, surprisingly, for lawyers in case complicated legal issues arose. Then I took the elevator up to the second floor, and immediately when I got off, I saw a transgender female teenager sitting there with makeup on, who gave me a very warm, innocent, but lonely smile. And on the couch on the other side, there were two boys sitting there quietly, holding hands. And this entire environment made me reflect on my own youth in my old neighborhood in the 1970s, on 15th Street and 8th Avenue, long before getting wiped out by gentrification. All the kids were poor. There were about 50 of us on the block, always playing in the street, the fire hydrant, an abandoned car. Games like Johnny Ride a Pony, Kick the Can, Stickball, Ring-a-Lario, Scalsies, always going home dirty from head to toe. But one of my closest friends, William Dominguez, never played those games with us. He could always be found playing double dutch with the girls on the sidewalk. He was an intelligent kid and a good student. He liked to talk about science and the solar system. And we would frequently skateboard all through New York City together, just me and him. We'd skateboard in the plaza in between the Twin Towers. It was nice and smooth, but the problem was the security guard would always chase us away. We skateboarded on the upper level of the abandoned West Side Highway and the underground tunnels connecting the subway stations on 14th Street, where they filmed the movie The Warriors. He came to every single one of my birthday parties, without fail. But on the street, when the other kids were around, the tough kids, the macho kids, the kids that called him Dominguez instead of Dominguez, he kept his distance. His Dominican mother would scream at him out the window in Spanish when it was time to eat, which just added to his embarrassment. We all knew William was gay, and his mom did too, long before he would ever admit to it. Maybe for fear of losing friendships, maybe because you had to be tough, and gay was just not part of being tough. Or maybe because we just did not do enough to make him feel comfortable in his own skin. And William escaped many of the traps of New York City poverty, like using drugs, by joining the United States Air Force. He was a straight arrow. And when he returned, he was confident. He held his head higher. And he very noticeably had a boyfriend named Eric, who you could tell he cared very deeply about. But he still would not talk to us about being gay. Then one day, William contracted a strange disease, like many other unsuspecting gay men in the 1980s, and he died. And I've always felt guilt about not doing more to make William feel accepted and loved. Because when you were made to feel like an outcast by society, like a second-class citizen, whether you are because of your sexual orientation, your race, your ethnicity, a physical handicap, whatever, as a doctor, just treating those patients like everybody else is not enough. You need to give them a little extra attention, a little extra love. And the Mount Sinai Adolescent Center provides that. From the guy who sits at the front desk who welcomes you in with a smile, to the janitor who's joking with the kids as they're waiting there on those chairs on the first floor, to the compassionate nurses, to all of you here today who support the Mount Sinai Center, the Mount Sinai family. I wish William had known about the Mount Sinai Adolescent Health Center back then. While it may not have saved his life, he would have at least felt loved, like he belonged. Because in the battle for human rights, for human dignity, first, there is the right to just be, to just live safely. And that is what the Mount Sinai Adolescent Center is all about. Thank you.